Ma'am has guided 41 postgraduate and 18 PhD scholars, co-guided 6 others, and authored 112 research papers in reputed index journals. Ma'am has also penned 3 acclaimed books, including Concept of Glaucoma in Ayurveda and Modern Science, Comprehensive Approach to NASA Rogues, and Ayurvedic Oculotherapeutics, a deep insight into necrotriacal. As principal investigator in 39 research projects, Ma'am has actively contributed to advancing Ayurvedic evidence-based practice, with over 52 national and international lectures, 50 chairperson sessions. Ma'am has been honored with prestigious awards including the Sheikh Zayed International Award, Abu Dhabi in 2024 for outstanding contribution in Ayurvedic and Best Teacher Award, Goa in 2023 by TAS India. Beyond academia, Ma'am has also contributed to PG curriculum development and CISM 2024, SOP formulation for CCS, and has served on several scientific and selection committees of national deputy. We are truly privileged to have such an inspiring personality among us today. Let's welcome Dr. Shamsha Ma'am with a big round of applause.
Thank you, Dr. Anupriya. So, good morning to all of you. So, I can see very new, some new faces also. So, why I select topic Jaloka Vacharan in eye, because I have seen that very few people are practicing this Jaloka, and especially I think it's in Kerala. I feel they are doing a lot of work in Jaloka, but when we really delve deep into this subject, we can say that definitely it has a great role. I think you are able to hear me. So there is a lot of scope when we really practice this Jaloka Charana, and I have tried it in many new cases also where it is not mentioned. So that will be an add-on to our science, and I will show you also some success stories. So let us start the topic. So as you all know, Jaloka, when we are selecting Jaloka, we should know what type of Jaloka we need to select and how. So you have to select when it comes to the selection of Jaloka. So we have to see whether it should be a Leeche Jaloka. So if it is if it is not Jaloka is not selected in a proper way, if it is having Visha, that itself will give rise to adverse reaction. So nowadays it is very easy for us. Those where we purchase the Jaloka, they usually give us Leeche Jaloka. So that is not the problem. So we can see many classical references, because this is also very important. So whenever we do any therapy or when we practice, we should also see where are the references and which all diseases we can practice this, so that we can get a hint. So when such patients come to us, we can really adopt that. So you can see that even in Charak Samhita also there it is mentioned, and in Shishruta Samhita, and even in Ashtanga Hridaya we get a detailed reference of this Jaloka, and we can definitely practice it. So okay. So here you can see classification of Rakta Mokshan. So Jaloka, it is one type, subtype in this thing, Rakta Mokshan. So there are many such procedures. So we can either use the Shringa, or we can use Jaloka, or we can use Alabu. So different techniques are there. We can also go for Siravir. So but basically I have in this PPT I am going to focus mainly on this Jaloka. So there are so many methods. You can also use the Ghati Yantra. So nowadays you see we are doing cupping therapy. So that is nothing but the technique of the Ghati Yantra, that is cupping. So we can correlate it into the same way. So you can use these techniques to practice Jaloka Charana. So as I said you, we can exclude the ones which are told. See, detailed description of this characteristic of this Sarvisha Jaloka and this Nirvisha Jaloka, detailedly it is mentioned. So you can go through looking at its mouth and its structure, its body, etc. So you can decide. So in this Nirvisha, we can select any of this. So there are also so many types. Just like in medicinal plants, we get so many varieties. So in Jaloka also we get so many types. So usually in eye, when we are selecting, this Jaloka size should not be very big. It should be little medium size, because when we are applying it into a delicate structure. So because I have used one few Jalokas, I don't know the name, but when I applied it to the this thing phonics, so that bite mark was very big. So it was like it's a triangle type of mark. Some bite mark was very big. So it was like 3 cuts. So there was I don't know what type of. So that type of, there was lot of bleeding in that. So that's why better to apply small Jaloka. It will give, we can manage the adverse effects afterwards. Like if it is a very big Jaloka, you can see there will be lot of bleeding. That I will show you in my slides. Okay. So you can diseases wherever there is vitiated rakta and this thing pitta, there you can freely apply Jaloka. So wherever there is inflammation, wherever there is redness, any condition of the eye, so these diseases will be fulfilled. So you can think, so any red eye syndrome, chronic red eye syndrome, then chronic iridocyclitis, then you can use it in uveitis. I have used it in many. Then you can use it in allergic conjunctivitis, and even in case of BRBO, retinal vascular disorders, that also fall in the same category. You can use it in such this thing also, diseases also. And adhumans also, anyway, adhuman they have mentioned. Siraved also we can do. We can also go for Jaloka. So I will show you the technique how I do, and that gives better result in case of adhumant, where we have to apply the Jaloka, because that is a new technique what I have introduced. Okay. So even in Vidradi abscesses etc. usually in eye we don't get like that, but we can apply. So in eye we can but along with this Jaloka we can club other parasurgicals, like you can go for Shara Karma, then you can also do Jaloka. The lesion is very big where you need to do Shara first, so you do Shara Karma. So that lesion will reduce, that size will reduce. After that, for the Rakta in Pitta Dushti, that if that Dushta Rakta has to be removed, then you can go Jaloka. So these are the indicators. And the contraindications are equally important. So you should know where you have to do Jaloka and where you should not do. So if you do Jaloka, Rakta Mokshan in any form in such patient, there will be many adverse effects. So you have to know, SOPs are very important whenever we are planning and designing any treatment procedure. So you have to follow this. So especially bleeding abnormalities, any type of bleeding hemophilia, you can see, we can select all that. So that is why we have to go for the CBC test. So you should know the blood group also, and you have to go for CT, BT, all that is very requirement. Serological test, all that should be done, and so that if the patient is very weak, so even in classic very Krusha or Pandu, and very weak individual where there is already Rakta Shaya is there, in such patients never go for Jaloka. So in cirrhosis also it should be avoided, and bone marrow suppression in all this patients those are undergoing therapies. So better not to go for bloodletting. So it should be followed under aseptic precaution, and even in pregnancy it is not a good choice to do Jaloka. So whenever we are doing any procedure, as you know, we have to follow the protocol. What is the Purva Karma, Pradhan Karma and Pachar Karma. All these are 3 are equally important, because any one also you leave behind, and if you don't follow the protocol, then there will be many adverse reactions. So you can see, so what are the Purva Karma? So Purva Karma should be done not only to the Rogi, but also to the Jaloka, and also we have to prepare the site also where you are doing process. That all should be kept, should be sterile, hygienic. You have to see whether the patient is fit for Jaloka, and you have to do the prerequisite test, all this HIV serological test, and also you have to go for CTBP percentage. All that you take a note of it, and then you can start. So at least for the first sitting when you are doing, you follow this protocol. Then later on you need not do. So you have to see the Rogi Bala also, whether he is fit for that. Because I have seen many patients who are very like Mrudu Bala patients. Once we apply, their BP will rise so much. It is very difficult to control. So counseling is also important. So some patients, they look at the JALOKA only and they become scared, and they have 2-3 patients whose BP suddenly raised. So it will be difficult. So you have to counsel the patient. You have to. Otherwise, when you are doing, you don't want the patient to know what you are applying. You can just cover the eyes and you can do if you are doing it externally, or if you have to do it on the eye, then also you have to prepare the patient and you have to counsel, and then you have to do the procedure. And if they are not willing, don't do it, because 1 or 2 patients, they don't know, we don't want to apply, so you go for other procedure. So that time I had to go for CeraVec. So that's, some patients are very testing, so you can take your treatment. And selection of leeches, as I told you, we shall selected. And what you have to do for the leech also, come from clean ponds you have to take, so that water is not contaminated. Even if you are bringing the JALOKA, you have to store it in this thing, glass bottles, and you have to change the water at least once in 2 or 3 days, because I have seen in Jaipur it is very hot, so many of us will die in summer, because it is very costly when we purchase it from outside. It is 200 or 150 like that they sell. So when we order at least minimum 10, and if they die in that way, it is lost to us. So that is why store it in a place, and it should there should not be much light also, because that JALOKA, they don't want much light, so it can cover it. Or you can use this earthen pots. That is also a good choice. You can cover the mouth. And when you are before Purvakam doing on the patient, you are just take it out and put it in little Haridra Jala, and then that will be more stimulated. It becomes more hunger. That hunger reflex will be too much, so that it can suck the quantity of vitiated rakta in a better manner. So you have to put it in there, and then you have to after that what you have to do for the patient, you after doing all the procedures and counseling everything, you have to make him lie down, and then you have to clean the area where you are doing JALOKA. So usually what I do, we do Snehan Swedan, so the effect will be very good, because even without Snehan Swedan also I have tried, but that much response will, because when we want to especially apply it on the vessel, so first I do CeraVec and then I apply. So in such cases, the veins will not be visible. So that is why when you do Snehan Swedan, etc., hot fermentation, etc., the veins will be easily visible, then you can easily do the procedure. Okay, and then you have to also keep all the things ready, because once you start the procedure, any complication arises when there is excess of bleeding. What are the medications which you need? All that should be stopped, because last minute you cannot ask the patient to run and get the medicine. You have to keep it in ready in advance, so that you can use it in your post-op period. So in this procedure only, like if there is excess of bleeding, what you may have to use Trenexa tablet. Usually I use that. So in that way you keep those medicines also ready. And if there sphatic asthma is very important to stop the bleeding, so that also should be kept ready. And cotton and all sterile things, cotton bandages, everything should be kept in place, so that it is easily approachable and you need. Okay. And then after the post-op period, you can also do this thing, Triphala Quarth Parishet. Triphala is also Amala, no? That will also help in stopping the bleeding. Haridra should be kept ready because we need in post-op period. So all that you keep it in a tray, and it should be in a systemic manner. Then we can start that. So this is the usually before treatment we usually go for this test. And if anything you need extra, you can also add on related to your disease. If you want to know any specific outcome of that, that also can be added. Okay. So in Pradhana Karma, so you have to apply the leech. So leeches can be applied in different places. You can apply at the site of pathogenesis. That is, wherever there is this thing deformity, there only you can apply. So if it is in case of allergic conjunctivitis, you can apply it in the fornix also. You can apply it on the palpebral conjunctiva. So you can select the site. But if you think that it is or more vascular region, you want to extract the more blood, especially from the vessels, that time you have to use any of the siras which are visible around the eye. You can just go for CeraVate and then you can go for JALOKA. Just apply JALOKA. I will show you. And then initially see some when we are doing blood letting also, sometimes there may be itching, some manifestations will be there, mild pain will be there, but you have to ask the patient to calm down. There is nothing, these things will happen, because sometimes patient will be very much, there is itching and all, because one or two patients will be like that, I know, because I have come across. So you have to counsel, nothing will happen, first time we are doing, you will be all right. After some time like that you can. So initially when you apply there will be some reaction, but afterwards there will be it will be smoothly, it can be managed. Okay. And once you apply the JALOKA, you can see that it starts sucking. So it has a very good once you apply, it will just stick to that area and it starts sucking. And you can see how the JALOKA keeps on enlarging, and the more it sucks, the more bigger it becomes. So you can see that also. And see, you can see how like in Pradhana Karma only, how much blood you want to eliminate. Usually the JALOKA will suck only the vitiated blood. After that, and if it has grown sufficiently big, then it will leave automatically. But in case you feel that it is sucking more amount of blood and you want to remove, just apply little sangam or turmeric spot. Immediately it will, you don't try to pull it out, because that will cause more, the wound area will be increased, and it will also give rise to pain, and it will also hurt the JALOKA's mouth when you try to pull it with the force. Okay, so you have to do. And after that you have to, so after in Paschat Karma is very important, because it's like I feel delivery is going on, the baby, you have to manage the lady also, both like that. I feel like an emergency, so some person should be there to manage the JALOKA. You have to manage the patient, that is very important post-op, because there will be a lot of bleeding. So you have to keep an eye on the patient, and someone should take care of the JALOKA. One person cannot do both the things. So because if you don't vomit in a proper way, you can see like there will be the JALOKA, either it will die, or it will become very sluggish, and in next this thing also, like that Indra JALOKA disease will occur, and it will not suck blood, or its disease will come, and we cannot use it for other patients. So we can use the same JALOKA for the same patient. So better not to use JALOKA on other patients. So same patient, you have to use the same JALOKA, and you can use it after 15 days. So there is no problem, but you give a gap at least for 15 days. Usually 7 days also I have used. There was not much problem, and 15 days is the best option, as they have told in classics. Okay, and so when we are applying, you see immediately you take the JALOKA, and then you put it in you take it in a kidney tray, and you can put little Sindor, and it will start vomiting. So you Haridra also, you can put Haridra also, that will also give the JALOKA starts vomiting, and then you can sometimes only little blood comes out. So the JALOKA will be very huge. So that time you have to remove that excess of bleeding from the tail, and you can just compress it in the mouth. That also will help in Samyak Vaman for the JALOKA. Okay, and for the patient, once you remove, you have to keep ice also ready. So sometimes you can put this Spatika Basma, and you can compress it so that the bleeding stops. So that's why CTVT is very important. So the bleeding stops. If it does not stop, then you have to use this Spatika Basma. So that also should be kept in, take it in a gauze, and after that you have to use ice packs also. And after putting the JALOKA, at least 1 hour you have to keep the patient with you. If you don't monitor in that stage, they may be bleeding afterwards, and when the patient goes to the ward, there will be problem. And don't do it as an OPD procedure, because patient, when he goes home, if anything happens, then it will be the risk of the consultant. So anything may happen. So that is why, especially if the patient is hypertensive and all, you have to see the bleeding is fully controlled, and then only you have to shift him. 1 hour at least you keep it in the same room, and you have to monitor the patient time to time, so that not there, because I have experienced one or two patients. So if they were post-operatively not managed properly and they are sent to ward, there will be some subconjunctival hemorrhage. I have seen it. So that also should be managed. So it is not that we have to leave the patient and be scared or anything. We can manage it with cold pad, with frequent cold pad, and then you can give this parishake also, the blotra, then this amalaki parishake. All that will be helpful. Ice pack will be very better if we have to control the post-operative bleeding. Okay. So this was the case. See, this patient, because I had some important urgent meeting, so I asked my students to monitor the patient, and I went to that. It was very urgent, but the students, they thought the bleeding has stopped. They sent her to the ward. But immediately when I went for rounds, there was a lot of huge subconjunctival hemorrhage. Then I had to manage the patient. So we don't need to worry. Sometimes complications also happen, but we have to learn from our mistakes. It is not that like we are also in the same this thing. Sometimes something may happen, but we have to manage. And she became all right. Only in 2-3 days, everything was stabilized. So there is no need to worry. And death of jalokas. Many jalokas I have seen. If we don't do samyak vaman, they have died. In my this thing also I have seen many jalokas have died. So you have to be very careful, and waste disposable. Whatever blood is coming out, that has to be carefully followed. All the SOP guidelines have to be followed and be disposed. All that bloody material what is coming, and the gloves, everything disposed in a proper way. So this also is very, very important. And usually after applying jaloka, what all complications? Sometimes there may be infection. So if it is not properly managed, so as a precautionary measure, you can also give some antibiotic also if you want. You see some patients if they are diabetic and all that, and you have to manage the wound properly. So their sugar control will also be very equally important. So that also you can monitor. You can also give some antibiotic, and then you can. Usually I give some eye drops. Moxifloxacin eye drops usually I give as a precautionary measure. Better to give any infection. If it takes place, then there will be adverse reaction. And this subconjunctival hemorrhage is one problem, and hematoma also may be there, and there may be prolonged bleeding. So in such cases, Trenexa tablet usually, or sometimes if there is too much bleeding, you can go for injection also. But tablet usually at least only tablet. And some allergic reactions like keratitis, but in my case I have not seen any such reactions. So even if there are reactions, you can manage with netra parishek. You can do triphala ludra HT continuously. You can do parishek. Then you can use this osteofen, everything, and you are using anyway. You are giving antibiotic also. Then that will be managed. So there is no need to worry. So these are the preventive strategies, like whatever you are doing, keep all this in your paschat karma. Before that only, if you are planning for jaloka, you have to take all these precautionary measures. Whatever you are doing, you should follow the right techniques, and all this anti-fibrotic analgesic, as I told you, Trenexa and all that should be taken care of. And then is post and pre-procedural counseling. Even after you send the patient, after doing the procedure, you can ask her, like tell her that if there is any problem, monitoring. So if patient says anything, I asked her to send any picture of the site. So that also you can do if you are planning to send her to the ward or to. There should be in continuous monitoring. That is very, very important. And anything happens, ask them to inform any reaction takes place. That also, in that way you can manage the complications in a better way. So sometimes there may be these complications, but they have not come across, etc. But in my practice, I have not seen very hot or cold temperature. Very hot, I think usually extremes of temperature also there may be problem. So that is why you have to monitor whenever you are doing any kriya kalpa. It is very important to maintain the temperature of the room. So you can take care all this nowadays. And you have to give little laghu ahara before the treatment, so that patient not feel hungry immediately, okay? Because they should lie down for a long time. So now let us see what are the active components in leech. So because a lot of research is going on, so many people are applying JALOKA, even the allopathic people and other people of traditional medicine, etc. So we should know what are the importance. Which is pyridine, as you all know, so that is anticoagulant. So this is very very important. So you can use this because of this pyridine, you can use in most of the vascular disorders. Even in case of diabetic retinopathy, hypertensive retinopathy, this will be because of this pyridine. You can through the Netragat Siras if you want its action at that site. Okay. So and then you can also, this scalin is also platelet, it inhibits platelet aggregation. So this is also one important. Then destelibase, this is also thrombolytic enzyme. So hyaluronidase, that also breaks the extracellular matrix. So in that way, it is very useful for reducing edema. So whenever there is edema, whenever there is shota, we can use it. So in case of Adhimantam, that is the thing what we want. We want to reduce the shota at any level, so you can use this. And at the same time, whenever the vitiated rakta is removed, the rakta which is fresh rakta will get into because of the negative pressure. This rakta from the other parts also goes in. So that will have more nutrient benefit. So that nutritional supplementation will take place at that site, and in that way there will be better healing. So that is also very very important factor. And eglin is also anti-inflammatory and it is also having analgesic properties. And, so you can use it in any inflammatory eye condition because of this eglin. So I told you, in case of keratitis, you can use any red eye syndrome. You can use this. And also it is having this antibacterial peptides. So that is why it will control the inflammation. So you can use it in uveitis, so that it's very very effective. And also reduces secondary infection. And also it has this factor XA inhibitors. So this is also very important. So these are lifaxin, gelanthin, and all this substances. So this all substances, how will you act? It will improve the microcirculation of the eye. So in that way, you can use all these benefits. So in what I feel that when we are using it in the eye, so these all actions where in which disease you want. So based on that you can apply. So if you want to improve the microcirculation, especially in the vessels of the retina, so you can apply it externally. So that JALOKA or whatever content, because the leech is having that. So that blood will enter into the chemical constituent of the leech. Through the leech it will enter into the circulation. So in that way, that same component, so it will be further transferred to the retinal arteries or veins wherever we want action. So in that way it will help in improving the microcirculation, improving the quality of nutrition, removing the if there are ROS formation or whatever pathologic factors are taking place at that site. So all that can also be removed through the vitiated rakta as the JALOKA starts sucking all the vitiated things, whatever are there in the blood, unwanted substances, that will also be sucked out. So in that way, the blood which is more potent, that will reach the site. That is this thing. So in that way, it will give a lot of therapeutic action. The therapeutic action can be enhanced because of this. So you can see here, JALOKA, and there are so many studies also. So you can, it will not only reduce the pain, swelling, congestion, all these symptoms can be reduced. So that is why in chronic allergic rhinitis I have used JALOKA. It will give very good result. That congestion, itching, everything will subside when you apply in 1 or 2 applications. That is important. And safety also you have to see. And there are so many protocols. You have to the limitations also are there. But if you use it in a proper manner and in a judicious manner, definitely you can get the result. These are the, I will show you where all I have used it. So this is a case of, I have used it in glaucoma. So you can, this patient So his pressure when he is from Mumbai, when he came to our hospital, he had the problem of increased IOP, 68 in right eye and in left eye also for 58 or something, because both the eye was increased. The patient became diamox, he has undergone trabeculectomy in both the eyes. Also. Then too his pressure is not under control, and in right eye the vision also is very less. So main problem was he wanted to control the pressure also. So he came to us. So with JALOKA voucher, so have applied in upper phonics. You can see the testimony, patient testimony also. So once you hold the JALOKA and you apply, it will automatically form a grip and it will start sucking. So you can. So you have to be careful when you are applying upper on this thing palpebral conjunctiva, lower conjunctiva. So usually in upper palpebral conjunctiva you should be careful in post-op period. So if there is any bleeding, it will give rise to this subconjunctival type hematoma type. So that's why properly it should be controlled. So when you are applying, you should be little careful. Sometimes you see the JALOKA will not get this thing. It will not stick or it will not suck the blood at any cost. So that time either the JALOKA is not active, we can activate again by putting it in Haritra Jala, and then again we can make it to work in a better way. So this patient he had optic atrophy. In such case also I have applied. There was failed graft. Keratoplasty also he had underwent. That failed graft was there. He had an injury. So after that he came to me. So vision was very less, but there was redness and all that. For that I applied this. So it gave good result. So patient himself will be very happy. They will only tell you apply JALOKA. So if it is fit and if he comes under our category, definitely we can apply. So wherever there is redness and all, we can apply it. So sometimes we have to use many sittings of JALOKA. At a time I have applied to both eyes, 2, 3, 4 JALOKAs also I have applied. So we can, depending upon the case, we can do it. So this is also a very interesting case. Orbitals, periorbital swelling. So this patient, she had severe pain in the eye, and there was huge swelling, exophthalmos type, and it was a case of subclinical hypothyroidism, and there was severe pain. So because of this pain and swelling, the patient had to take this prednisolone. Repeatedly she was taking it orally. So because of that, continuously whenever the pain and swelling used to come, repeatedly she had to take this prednisolone. So she was using it since 4 years. So when she came to me, and without that, that pain and swelling usually used to advance. So if she had to take prednisolone, then it used to reduce. So this patient also came to my OPD. So we have applied this JALOKA. So this after applying the JALOKA, and we have to do some Shodhan Chikitsa also. Immediately after this, we stopped this thing prednisolone. So the pain after doing JALOKA and all the therapies, the pain completely subsided, and she is no more on prednisolone, and there is no pain, and the swelling also is under control. So that is the result. So if the chronic, if the patient is also taking steroids, etc., so we can avoid all that. So yeah, there are many patients of granulomatous uveitis. In such patients also have applied JALOKA, and some patients they were using this steroids continuously. So have to stop the steroids, put them on Shodhan Chikitsa. I have gone for Snehapan, Leeche, etc. And after that, I have gone for all the systemic procedures because that is also important. So where we need to apply systemic, we start with the systemic therapy, do the this thing Sharira Shodhana, then you do the Shira Shodhana with Nasya, then you can go for a local application. That will give very good results because in chronic diseases you have to manage in different ways. Otherwise you will not get that effect. So that is why you do it. So this patient also, he had severe headache. So here I have used JALOKA, directly I have done a puncture on the vein and then I have applied the JALOKA. So once we puncture the vein and we apply the JALOKA, from the vein only it starts sucking. So that will give very good effect. Like Siraveda, if you just apply and if you leave, only little blood comes out. But when JALOKA is sucking from the vein directly, it is going to suck. So there will be very good result. Okay, so whenever I do, just identify the vein, then you just prick it, and then you before removing the needle, you just put the JALOKA's mouth there. So it will be directly on the vein and it keeps sucking. Actually, if we are doing externally outside the eye, it is very easy to manage. But when we are doing inside the eye, little precautions we have to take. But I have not done it on the vulva conjunctiva because there may be chance. I have not tried so far. Phonics, up to phonics I have gone. Very good case. So this is a case of branch retinal vein occlusion. So this patient, he came to us. When he came to us, he was not knowing that he was hypertensive, or he was knowing that he was diabetic. So we checked his parameters, and because of the hypertensive, he had developed this VRVO. So we first put him on Shirodhara, Takradhara therapy to manage the hypertension. So after that, the next treatment was for the JALOKA. So that gave very good results. So in this way, this patient, this is the information of the patient. So he was a 52-year-old person, so he a businessman, and he was a little more aware. Like he consulted, he went to many ophthalmologists, so they have advised him anti-VEGF, and he consulted many people. He had many doctors in his whole home. So they advised you have to take many injections. Once if you start the injections, the outcome is also not so good. So better you go for this other therapies like that. So he came to know about our came here, and he was even though he was hypertensive since 1.5 months like that. When he came to us, we had diagnosed, we started the treatment, and so this was the date when he came. His vision was in left eye there was VRVO. His vision was 6/60. So when now presently yesterday also patient came to me. His vision is 6/24, and this macular edema was also there in this. I'll show you. So in this there was hemorrhage, especially in the superiotemporal area. So OCT findings, so this was this profile, the HbA1c was 9.1, so it was uncontrolled, and he was not moving also, and RGS also was increased, and this is the fundus feature. So it was like this. So edema, you see, it was 5/61 when he came to us. So after doing this JALOKA, I think there was a reduction in the subretinal fluid, and the edema, it came down to. So see, whenever we are applying therapy, one therapy I don't apply. We have to approach in multiple ways. So we have to manage the BP also. We have to the other conditions. We have to give him anti-diabetic medicine, anti-hypertensive medicines. So that's why we have given him systemic medication. Then we have given this Takradhara, then Tarapudikil, Teshti, and all the Shita Viladravayas, Ludra, etc. So you can see. So in this way we have managed. Nasya also with Durva Swarasa. So Rakta Pitta Chikitsa should be based on Rakta Pitta Hara Chikitsa, that's why. And Jaloka Charana was done. Netra Parishek also again with the Rakta Pitta Shamaka Dravyas, Manjishta, Rodra, ST, all that I have used. And Aschatan also, Guruchi and this Guruchi Patra, and that is also very good, Aschatan, what we can use in this case. And I've also used this, like if you don't have this Swaras directly, if you cannot prepare, we can use Netramrita. Many cooling eye drops you can use. Spatik, Jala also I have made and I have used it as this thing, Neta Parishek. Okay, and Tala put little bit Musta, Manjishta, Rodra, etc. So this is, so I have done Jaloka, especially I did it on the Sira. So because that will blood like it will reach into the retinal blood vessels, whatever it is, through that mode I have used, and I have shown you the important chemical constituents which are present in the leech enzymes, etc., which are present in leech blood, that will mainly inflow into the system of the patient, and that will start acting. So you can, that is why you can see the tremendous result. Especially you can see the change in the caliber of blood vessels, which were direct, torturous, etc. That became almost normal, and it gave a very good result. That once the bleeding is there, it will take more time to reabsorb, which has already there is some fluid collection, subretinal fluid, etc. Especially in the macular area, it will be totally affected. So that is why little visual outcome will be less, but the recurrences can be prevented, because you see once we start anti-VEGF with one injection, I think there may be very less 50 to 100 micron reduction in edema, and sometimes there may not be that also. But in my treatment with one sitting of Jaloka, 100 micron reduction was there in with this thing, Jaloka, and also that vascularity, that tortuous nature of the blood vessels, that was also normalized, and in this way you can get the better result. So usually I have applied it on the Sira, and in second sitting I had applied this thing also, conics and this upper and lower palpebral conjunctiva. And internally also I have used some medicines which will be helpful for controlling his hypertension. So Sarpagandha is very good. So I have used Sarpagandha, Ashwagandha, then Shatavari and all these medicines. I mean Pravada Bhasma, Shankar Bhasma, all this I have used here in this case. So you can see how is the improvement you can see. See, along with that Chandanasa, Rodrasa, that is also very, very important. So you can put him all on Pitta and Rakta Shamak Chikitsa. Overall you have to manage the patient, because such patients, if you cannot achieve anything with one single therapy, multiple therapies you have to use and plan it in a judicious manner. That is very important. And what you have to do first, second, third, or what therapies you can club, because patient's time is also very important. They will have a limited, because he's a office goer, he needs to be, he cannot give much time to us. 8 days maximum he can give. So in that 8 days, how we can manage, that is very important. Takradhara, I mean Shirodhara cannot be done at the same time. You want Takradhara to be the main treatment. You start with Takradhara, put him on Patimarshanasya. So that will manage. Then you can go for Netra Parishek, and in between you can do Jaloka. 3 days you put them on that therapy, then you can do Jaloka. Then again on the 5th, 6th day you can also do Jaloka. 3rd day, after 3 days again you can do. So this is the, so you see how the vessels were so much tortuous, dilated, etc. Now how it is. And the edema also, you know, this was 561, no? And this thing, it came to 387. So in that way there was improvement. So improvement will be little gradual. So immediately after Jaloka also it came to around 478. Second or third day we measured. So in that way they will be with one sitting there will be at least, because I have done for many patients, I have noticed that 100 micron decrease in the this thing, thickness that we can get for sure. It became 475. From 561 it became to 475. So I have this video also, this patient's testimony. I had put many photos. वीडियोस आते हैं ना वीडियो वाले के साथ व्हाट्सएप पर नहीं ये नहीं व्हाट्सएप पे तो व्हाट्सएप पे निकाल के डालते हैं